In the name of God, this lecture is about basic principles of human eye anatomy for undergraduate students. I will go through briefly to basic points, and in the next lecture, I will extend more. This is the gross structure of the eye, which is protected by eyelids and eyelashes from mechanical or environmental insults to protect fragile and delicate structure of the eye. This structure, which is looks like the transparent glass structure called cornea, and this black hole in the center of the iris, which is colorful part of the eye, is called pupil. The cross-sectional schematic structure of anatomy of eye was shown in this picture. As you see, the most anterior part of the eye is called cornea, transparent structure which has 43 diopter power and cause refraction of the entering light, and transparent as an avascular in order to transfer the light to the eye for the vision purpose. The space, empty space behind the cornea is called anterior chamber, which is filled with a transparent liquid called aqueous humor. This green structure in between cornea and lens is called iris. A hole in the center of the iris is pupil, which size of this roundish hole is adjusted with the constriction or relaxation of muscles of iris in order to adjust amount of light entering to the eye. The structure behind the pupil is called lens. This transparent biconvex structure is crystalline lens, which is suspended by suspensory ligament of the lens or zunules in order to adjust thickness of this lens, which subsequently will change its power for distance and near object of regard. Once the light enters through the cornea to anterior chamber and refracted by lens, it comes to this large empty space which is the posterior segment of eye and filled with the transparent gel called vitreous humor. It is consists of mostly liquids. 98.8% of vitreous is water, and the other structure is the hyaluronate and as well as collagens. One of the globe is composed of 3 coats. The outermost whitish coat is called sclera, which has protective rule for glue. The middle layer is called choroid, which is responsible for blood supply of the globe, and innermost and the most important layer is called retina, which is responsible to transfer the light stimuli to the pulse of the neural pulses in order to be transferred to this yellowish structure, which is called optic nerve, to the visual cortex to realize what we do see. And retina has many blood vessels, which are both arteries and veins, and responsible to blood supply of the retina. The most important part of the retina for the very delicate and detailed vision is macula, which could be affected in the age-related macular degeneration. Also, the retina can be affected by systemic disease like diabetic mellitus, hypertension, and you should refer those cases in ophthalmology in order to be screened at least once per year. And if patient comes with the visual complaint with the medical history of the diabetic and hypertension, they should be referred urgently. Thank you very much for your attention.